Hope we're finally live. Can y'all see me? All right, it says we're live, but I'm having a lot of tech difficulties today, guys. Apologies for those of you guys that have been waiting. We're having a lot of tech difficulties, but I think I figured it out. Okay, I see a few comments coming in. But guys, let me know if you can hear me. I think Nana says yes. And all right, now it says we're rolling, 26 seconds in, 18 people watching. Hi, guys. Sue Mary says hi there. Nana says, can't see and hear you. All right, fantastic. Thank you, Nana. Appreciate it. Danielle says firecracker emoji. Jennifer says yes. All right, fantastic. Glad we're on. We made it. So sorry. We had some tech difficulties. I'm streaming from the gym, and I have like a whole portable setup that I take with me, so it's bound to happen at some point. I think we've done all right, though, so far. I have like a high-end webcam here, and I have to bring the mics with me, and so please be patient with me as I get this all set up. All right, let's talk through today. So I'm going to be doing deadlifts. I've already been doing it. Calf raises and sit-ups, and answering some questions along the way. We already got some questions coming along. K1 Yad says, we see all that sweat. Fantastic. You got to get a sweat in every day. Make yourself sweat. It's the way you should be. Yes, in Connecticut. Hello from South Africa, says Jackie. Fantastic. Glad you guys are all hearing me coming through loud and clear. All right, so I'll be answering questions. I'm taking a little break from my workout already. I'm going to get back on deadlifts and sit-ups next, just do calf raises. And let's get into some questions in the meantime. I can see questions from comments from YouTube and Facebook, not from Instagram. So if you're on Instagram and you really want to get a question in, jump on over to YouTube or Facebook, and I can see your comments there. All right, Cinders is here, and Cinders says, hi, I used to be supple, but now I'm stiff. So sorry. I can't cross my legs. It's too painful. Or put my knees to chest lying down. Can't squat. I am slim and avoided a hip replacement following your advice. I'm 70. Oh, fantastic. I'm glad you avoided a hip replacement, Cinders. Even in your 60s and 70s. It is common to get a little stiff as we age, and some people are just genetically more stiff than others. I am, for sure. Like I'm just not limber. You know, I can touch my toes. I can mostly bring my knees to my chest, but I'm not the most limber person ever. And I used to think that I could improve it, and I probably can, but the amount of effort, the amount of stretching, the amount of mobility work that it would take to increase, this much, it's just not worth it to me. I'm just not built that way. Versus you see people that are like in gymnastics and, contortionists, those kinds of things, and they're just naturally limber. They're born that way. They're inclined to do those things, and so they're just built differently. We're all built a certain way. Some people are built to lift weights. They're built more like a football player. Other people are built more like a marathon runner. We're just all genetically different, and I think it's best to just do what you're genetically best built to do. So if you feel all right, if you've avoided your hip replacement surgery and you're moving around great, Cinders, I think you won, and it's okay that you're not as supple as you used to be. Kimberly's here. She says, Mr. Live Chat, are you kidding? Best part of my Thursday. Oh, Kimberly, you make my day. Your passion for physical therapy has helped so many. I am truly grateful. You're making me blush through my brown skin here. You can't see it, though. Thank you, Kimberly. I'm glad to see you here. I think I've seen you on every single live chat that we've done, and I appreciate your participation. All right, TY is here. TY says, how do you treat proximal bicep tendinitis? It's up here. I've had it for a couple of years now. Shoulder hurts, mostly the front, but can radiate to different locations. Any good exercises, anything to avoid? 46 years old. That's a good one. Usually biceps tendinitis happens because of muscle imbalances in the shoulder, and the biceps tendon that goes over the front of the shoulder, so where you feel the pain, that's where it gets thick. You can even kind of like strum it right there like a guitar string, and it'll be tender in some people. Mine actually feels really good. Sometimes it's tender, but I don't feel anything today. Let's check this side. If you have tendinitis, it'll be thicker, notably thicker. Like when I'm, me as a physical therapist, I'll feel people's biceps tendons if they have pain in the shoulder area, and I'll feel thickness in one that's worse compared to the other. And so what often happens is the position of the joints of the ball and socket joint, because if this is the ball and this is the socket of the shoulder, the biceps tendon kind of comes around the front of the ball and attaches to the top of the socket, and it helps with stability in the joints. And so if you don't have good stability in the joint because the mechanics are off, something starts to break down somewhere. Sometimes it's a rotator cuff tendon, rotator cuff muscles. Sometimes it's the labrum, the cartilage in the shoulder, and sometimes it's the biceps tendon. So I think that the most common problem is going to be that you're not strong in your shrugging muscles, these upper trap shrugging muscles right there. And so when you're reaching up overhead, see this one right here, when you reach up, you should shrug. You should be closing the gap here between your neck and your shoulder. And if you don't do that, then you're just coming up right there. And what happens is the ball starts to go as high as it can within the socket, but it runs out of space. And so you start pinching things and you start overusing the wrong muscles. In your case, it might be the bicep muscle, because the bicep crosses the shoulder joint. It can help with raising your arm a little bit. It's not built to do that. You need to be shrugging. So shrugging exercises is going to be a much more important thing to focus on. Let me just get back to my team. Team, I got your text. It's because I was texting everybody on my team like, hey, I can't get on. I figured it out. I got a good team helping me out. All right, let me see. If you're on YouTube, you can do a super chat, by the way, and I'll answer your comment first. Otherwise, I'm just going to go down the line. No pressure to do super chat. Somebody said, thank you for my team. We have Jackie that says hello from South Africa. All right, let me get a question I can do some exercises with here. So Jill says, I have just had cortisone injections for hip bursitis. What exercises would be best to do after recovery? Okay, this is a good one. So if you just had an injection for hip bursitis, then that means you're overusing the bursa in your hip. So you have to take the pressure off the bursa by exercising the right muscles. Oftentimes you do too much. If you're using your hip abductors on the sides of your hip, which causes you to use your thigh flexors right here, because abductors are on the side like TFL, glute minimus, and then you have quad muscles right here. If you're using these muscles too much, something will start to hurt, and sometimes it can be that bursa. So the injection might help temporarily, so you can get some relief. But what you have to work on next is glute activation, number one. Just getting your glutes to turn on, because oftentimes people, they just struggle with that, can't even get their glutes working. Once you get your glutes active, then the next step is to use your glutes in all the exercises you can. So like, you shouldn't be in the gym doing exercises right now if you can't get your glutes active. You're going to be using your quads and the wrong muscles, the ones that cause the hip bursitis. And it's just going to exacerbate the problem. So my advice is be at home, contract the glutes, get them tired, get used to doing that. Then begin to use the glutes in easy exercises like bridges is a really basic, easy one that you could do. Begin to use the glutes while you're walking. Once you can do that, then start to do like some tiny squats where you're just sinking down a little bit, but focused on using your glutes. Then after that, begin to get into more advanced exercises. And now that you have the injection, rest, make sure you recover from the injection, because sometimes it'll be sore for a few days. You have to begin to correct the muscle imbalance, because if not, you're going to end up needing an injection again, or the problem's just going to get worse. It's going to fester. and you're going to end up needing a more invasive procedure done, something like a surgery. So let's stay away from that. I hope that helps, Jill. Who's next here? Marlena Fina. I can't make out the picture there. Is that like a statue or something on the profile? That looks cool. Marlena says, I have several disc bulges and herniations with terrible radiating pain to elbows and right leg into toe. I am scared of surgery. I'm so sorry that you're dealing with this. Disc bulges can absolutely pinch the nerves that are coming out of the spine. And it could, those nerves go to your arms, so it can go into your elbows, into your hands, and they go down your legs, so they can absolutely go all the way down to your toes. The reason why disc bulges happen is usually because there's too much pressure going through the spine, abnormal pressure. Our bodies are designed to take pressure, right? We live in a world with gravity, so we need our muscles to counteract that gravity. But you need, because we're bipedal, we have some unique ways of distributing force around our spines. Our spines are up and down versus, like four-legged animals, their spines are horizontal, like a dog or a cow or a cat. They have different problems than what we get. Some similar, but as far as disc herniations, that's what human adults get, because we're distributing the forces inappropriately around our spine. So if you think of the spine, you have the back muscles, the muscles that run up and down the sides of your spine. You can feel them if you just put your hand back there. And then you have abdominal muscles in the front, and they kind of counteract each other. I'm speaking in real simple terms. There's more complexity to it than that. But if you don't have good abdominal control, good abdominal strength, then back muscles start to take over and they start to crunch a lot. And because they're directly on the spine, they're going to add the most pressure, the most compression through the spine. If that keeps up for long enough, something starts to break down. In some cases, it's the disc, and then you can start to get some pressure on the nerves. You've got to get stronger abs. And when it comes to the neck, if you have issues like herniated discs in your neck, disc bulges in your neck, it's very often the shrugging muscles in combination with the deep neck flexors, the muscles that make you make a double chin. Those are like the abs of the front of the neck. If you can get those stronger, and the basics is whenever you're doing like any sort of arm raising exercises, you just have to make sure to keep your chin slightly tucked, make a baby double chin, because people's tendency is they raise their arms and their head does this, their chin flies out. Or if it's just a one-sided arm raise, their head tilts over like this because they don't have good neck stability in the front of their neck, those deep neck flexor muscles. So get those muscles stronger, Marlena. Looks like we got a super chat here. Oh, we have a new YouTube member, Paul Rubbottom. Is that a prank name? Or is that your real name? I hope it's your real name, and I'm just not thinking of it straight, Paul. Thank you, Paul, for joining our group here. Let's see who's next here in questions. I was just talking to Marlena. Let's go over to Ronald Rodriguez. Who was your mentor on just working on your glute when all the other professional advised the quads? I've had a lot of mentors. I've read a lot of books. I still read books. Shirley Sarman is the one that I was introduced to by some other mentors throughout my program. A woman, physical therapist who teaches out of Washington University in St. Louis, sorry. And she wrote a book called Movement Disorders or Movement Impairment Syndromes. That's the name of the book. And that one just changed my viewpoint on all this stuff. And then as I started to just experiment with patients on the whole muscle imbalances, that's what really got me to solidify this whole muscle imbalance thing. And I bring up that book to colleagues from time to time, and they've never heard of it. I don't know. I tell them about it. I hope they look into it. All right, who's next here? Raymond Peter Corona says, hi, Dr. David, can you please show us how to do the dumbbell RDLs that target the glutes? I wish my recovery coaches were here to show you guys at demonstrating these. And here's the thing. I'm tall and I have a lot of spine and less legs proportionally. And so whenever I do hinge type movements, I end up using my back muscles too much. So I personally stay away from RDLs. RDL stands for Romanian deadlifts. I'm sorry. And it's basically a straight leg or a stiff leg deadlift. And so I do conventional deadlifts. That's what I was doing on the barbell a second ago. That means I'm bending my knees, and that targets my glutes. If you're not able to target your glutes on an RDL, then don't do RDLs. I don't do RDLs because I can't target my glutes on them. But if you can target your glutes on an RDL, then go for it. My advice is don't get stuck on trying to do an exercise that targets somebody else's glutes really well, but you can't do it on yours. Chances are it's probably a genetic issue. Maybe there's something you can crack and figure out, some tweak you can make and unlock your glutes working better. But chances are there's probably an exercise that you can do right now that can target your glutes really well. Do that. Focus on that. I wouldn't go focus on dumbbell RDL specifically. It's not a bad thing. I know it sounds like I'm trashing it, but I'm not trashing. I'm okay with it. Like if you came up to me and said, "Hey, I do RDL exercises with dumbbells and my glutes get tired every single time," I'm going to clap for you and say, "Congratulations, fantastic job." But if you're trying to force it to happen and you're just getting all hamstrings or you're getting a bunch of back muscles to work, stop. Don't do that. And same goes for deadlifts. Like I'm doing deadlifts, and if you just can't get deadlifts to work for your back, for your glutes because you're getting your back to work too much, as some people do, maybe you need to be on back squats or maybe you need to be on some other exercise. Focus on the exercise, Raymond, that gets your glutes to work best. There's a ton of ways to do RDLs. Tons of ways. Just make sure your glutes are working. Let's see who's next here. I got Richard McGraw. Currently have a slow healing humerus fracture. I'm using a bone stimulator and taking the Solgar calcium, magnesium, and boron. Fantastic. I hope you heal. Make sure, it sounds like you're talking to a doctor. You have to get a bone stimulator from a doctor. And so, yeah, it sounds like you're doing all the right things. Get it to heal so you can go back to life as usual. Best of luck to you, Richard. Joelica says, are there exercises you can after breaking a wrist to avoid surgery? Are there exercises you can do after breaking a wrist to avoid surgery? Yeah, you got to get your grip strength back. When you break your wrist, whether it's in here or like kind of forearm more so, because some people will say they'll call this their wrist because it turns a lot whenever you turn your wrist like this. You're immobile for 2 months or more while the bone's healing, especially if you had to have a surgery. It's probably going to be 3 or 4 months. They might have put pins and rods in there. And so you're just not using your hand very much because there's all these tendons and muscles that live in that area. You just can't be using them while it's healing. So the first thing you have to do is get your grip strength back, and specifically your palm. And so the best thing to do is get your palm to close. And whenever you're gripping things, watch, I'm going to go do my deadlifts. I need some more weight. This is my warm-up weight. You get some big plates, some big boy plates. Whenever you're going to grab bars like a barbell, you need to make sure to grab it with the palm of your hand, because if you're grabbing with your fingertips like this, hope you can see that, right, versus like this, grabbing with the palm, you're training your grip strength into an imbalance. When you grip with the palm, your fingers are going to wrap around whatever you're grabbing anyway, and it's going to work out. But most people miss the palm. So whenever I grip, I don't just grip like that with your fingertips. I put my palms on the bar and then wrap my fingers around. And as I'm doing the workout, you get tired. Your grip's gonna get tired, and the bar might start to like slide out from your hand a little bit. You need to set it down, readjust, and get your grip going. Now, this is advanced, right? You don't want to go to barbell deadlifts to strengthen your grip. On the low end, just wake up your palm muscles by doing palm closing exercises where you close your palm, avoid bending all your fingers, and just get these muscles here and here tired. A grip strengthener helps out a lot. They sell those with the spring on them, and you can squeeze them. And I have people hold it, but try to grip it in a way that doesn't curl your fingers around it. Keep your fingers open. So if it's like this and you're gripping like that, let me see. Oh yeah, here's one. The barbell clips are kind of like a grip strengthener. So this is a barbell clip, but same idea. You have handles, and then you're trying to grip this way. And so normally you'd wrap your fingers around it and squeeze it that way and hold, because that's what strengthens your grip. But you can see it's all fingers right there, a little bit of palm. But what you want to do, this is really hard, but get a grip strengthener. You can make it easier. Just try to hold without your fingers so much and get your palm involved. This isn't ideal. It's really wide, and I can't adjust it. I like the adjustable grip strengtheners. All right, hope that helps, Joelica. Let's see if we have any super chats. None yet. Okay, I'm gonna come back to our chat. Oh, we got Lawrence. Just said Lorenzo, maybe tag somebody on here. My ACC says, what to with patella lateralized, femoral anteversion, tibial external rotation, left subluxated. Is it safe to do any kind of squats for strengthening after initial luxation injury healed? Okay, so my understanding here is the patella was dislocated laterally. The femur has an anteversion, which means there's a rotation in the femur, and the tibia, the shin bone, has a rotation as well. And then the left subluxated, meaning there was like a partial or a temporary dislocation. Is it safe to do any kind of squats for strengthening after an injury like this is healed? Once you feel like you can move confidently, you can begin to exercise, but you have to just do exercises within your ability. In other words, don't go to heavy squats because you were doing that before and it's the first time you've done it since the injury. Start with light squats. Start with body weight squats. Give yourself a day or two, see how you feel, because sometimes the pain doesn't come on right away. It comes on the next day, especially with a dislocation, a subluxation, because you're affecting the cartilage in the area. And cartilage sometimes has a delayed response. You don't feel the pain right away. You feel it kind of the next day. You might feel some pain right away, but there's lingering pain. And that's what I would be worried about, my ACC. So think about instead using light weights, and I would go with high reps. So like if you were doing 3 sets of 10 with weight that was like 70, 80% plus of your 1 rep max, I would go with less than 20% of what you were doing of your 1 rep max and stick to like 50 to 100 reps and probably start more on like 50 or less the first time you do it and just get comfortable with that. It might take you a few weeks to ramp up to what you were doing before, potentially even a couple of months. That's okay. Wouldn't you rather be working out for the long term than, rush into a workout so you can get there next week and then hurt yourself again and then just be dealing with recurring injuries? Let's get healed so you can safely get back to long-term exercise. That's going to be what's best for you. We're at Richard McGraw's back. He says, 1 a day due to strength. Any recommendations? Let me see if I can put this in context with what you said before, Richard. You were talking about the fracture. This is the humerus fracture one. All right, so slow healing humerus fracture, bone stimulator, and taking the supplements. And then you said you're taking 1 a day due to strength. Any recommendations? You need to heal right now. If you feel like you can do some movement, so it's relative rest. In other words, because the fracture might be like hairline at this point, it might be mostly healed. If it's in that situation and you feel like you can do some basic things, and I'm talking like grab something small, like, this is my clip right here. I'm grabbing my clip. Aren't these cool, by the way? These are like those old wrist slapper bracelets, but they're barbell clips. Saw them on Shark Tank and how to get them. And they work great. But if you pick up something small, like less than a pound, half a pound, and it doesn't bother your humerus, go for it. And do that as often as you can without aggravating it. But if you start feeling an ache, a pain, that lingers, then you're done for the day. See what you can tolerate the next day, and gradually you'll be able to do more and more. So just be patient is my best answer, because most people, they want to do more and they're not ready to do more. You have to wait for that to heal before you do anything else. Hey, Coach Jay's here. He says, let's go, Doc. Thanks, Coach Jay. Judy Brown says, I have to have 2 total hip replacements, anterior or posterior. I'm 82. Oh, I don't know. That's not my call. So if you're asking if you should have an anterior hip replacement or a posterior hip replacement, these are just the types of surgeries. There's different types of hip replacements you can do. And it's really going to depend on what your surgeon's good at, how they're trained, what they've had the best results with, your body, your history, your lifestyle, what you do on a day-to-day basis. There's a lot of factors that go into it. And I am not in a position to tell you without seeing you. And I'm not, even if I saw you, I'd say, go talk to your surgeon. They're going to know best. And, surgeon A might praise highly the anterior approach. Surgeon B might praise highly the posterior approach. They're going to know better than I will. All right, who's next here? Oh, checking for the super chats. Don't want to miss anybody. Nothing here yet. Okay, where are you? Judy. Oh my gosh, I lost my place. Okay, found you here. Now we're on Tilly. Tilly 579 says, bad right hip, doing the glute exercises, don't have great range of motion. It's making my back tight. Is there something that I can do to help the lower back tightness? Oh yeah, there's a lot you can do. You got to start working on your abs, Tilly. A lot of people don't have good ab strength who run into hip replacements and knee replacements, and it's just because it's a chain of weaknesses that develop, a chain of muscle imbalances. It's not just the glutes. The glutes are key, but the glutes need a good pelvis bone, your hip bones, to be a foundation to work from, because your glutes attach to the pelvis bone, and then they attach down to the hip bone, to the thigh bones. But your abs on the front help to keep the pelvis stable. The reason why I'm bringing up the abs when you're talking about having a tight back and you're asking about what to do for the back tightness is that, to me, is a sign that your abs are not strong. And that's probably what set up the glute weakness, which is what's setting up the hip problems. So get your abs stronger. I have videos on how to do that. You have to focus on those lower abs specifically. If you think about splitting your abs into an upper and a lower half, watch. So you just find your belly button. My belly button's right here. The rib cage is right here in the top. So those are the upper abs. And then pubis bone is right here on the bottom. So lower abs right there. If you can get your lower abs to burn, to fatigue, you can get those tired when you're doing ab exercises. That's what's going to help you most, because let me go back to that view. When you suck in those lower abs, so lower abs right here, a lot of people let them hang out. They have a big belly like that sometimes, and back starts to curve. Sometimes they don't even have a big belly, just looks like it because their back is so curved and they're just sticking their belly out. But then when you suck in your abs, it flattens the back and puts some length in those muscles in the back, rather than keeping them tight and short, because they're tight and short because they're having to work extra because your abs aren't doing a good job. So get those abs working, Tilly. Richard McGraw from San Antonio, Texas. Howdy from El Paso, fellow Texan over here. Everybody says we're more like New Mexico. We kind of are, but we're still part of Texas, and I love Texas. I don't know. I can't call myself a New Mexican, really. My driver's license says Texas. My car says Texas plates on it. All right, now we have Ellen. Greetings from California. I've done exercises with you for 6 months. Fantastic, Ellen. I'm glad you're doing our exercises. I hope they're working for you. Comment. Let us know if you're having any improvements there. Arian, I'm not going to be able to pronounce that last name. But Arian says, hi, Doc. I had a partial ACL tear 3 months ago. Got physiotherapy after 1 month from injury. Now I'm better, but not 100%. I can run a little, jump, but not a lot. Injured leg gets tired earlier while walking. Ev, sorry to hear that you had a tear. It's no fun, an ACL tear. Glad that it was a partial tear. That's a big deal that you didn't have a complete tear, because the complete tears, yeah, it sucks. I hope you're in a brace. You need to be in a brace if you're not 100%. Get one of those knee braces, the big ones that have the hinges on it and the brackets on the side and the straps around it. Those are going to be super important to keep stability through your knees, so that you're not constantly just putting little extra forces through your ACL and not letting it heal 100%. If people just do that, people with partial ACL tears or old ACL tears that haven't healed, ACL repairs that are still causing people problems years later, get in a brace, and chances are you feel better instantly. And day to day, you feel better wearing the brace more and more. You'll reach a threshold where the ligament scars down and heals, and you'll feel tremendously better. You get out of the brace eventually. So my advice is get into the brace, and I would not stress it too much. So if you feel like you can run okay, great, but don't push it to where it hurts and swells. Not a good idea. I would stick to the brace and make sure that you're getting better, that you're improving day to day, week to week for sure. Hope that helps, Arian. We got a super chat. Tilly's on here. Tilly says, pull it up for you guys. Thanks, Dr. David. I will get on working on my lower abs. They're definitely weak. I know. I can call it a mile away, even though I can't see you, Tilly. Maybe I can. I'm just kidding. Those lower abs, they're such a big deal. And, I've only got one online program for back problems. I'm holding back on making more because there's other goals we want to accomplish first. But as soon as I get to it, I can't wait to tackle a herniated disc program, a stenosis program, a sciatica program, pinched nerves. Those things can be improved tremendously by getting stronger lower abs. And there's a whole process that I can take people through. So I hope to roll that out sometime real soon here. I'm glad that helped, though, Tilly. Put it to work. Check back in with me. I'll be here probably every Thursday, pending any crazy things happening. And I'd love to hear back from you, Tilly. All right, who's next here? We were on Arian. Here's Nikki. Nikki on Facebook says, hi, I just got a shot of hyaluronic acid in my right knee that has 2 meniscus tears. Oof. I have also moderate chondromalacia. What exercises should I be doing for my knee or glutes, I guess? Yeah, you should be doing glutes, absolutely. Glute progression. So start with, can you activate your glutes? If you cannot activate your glutes, start activating your glutes. Just wherever you are, standing, sitting down, lying down, just tension up your butt. Make it work. And if a bunch of other muscles fire, your thigh muscles fire, not good. Any glute exercises that you do that are harder, they're going to activate your thigh muscles, and you're going to cause yourself more meniscus problems and chondromalacia problems. So you have to just start with can you activate the glutes? With your situation, that's what needs to happen. The hyaluronic acid injection, I hope it helps. I sincerely hope it helps. I find that it tends to give people short-term relief because it's not fixing the source of the problem. Maybe you're getting some cushioning in there. Maybe the hyaluronic acid is helping the cartilage to heal and feel better and all that, and that's great. But you still have a muscle imbalance. That's what brought you to this situation. You have to fix that. Otherwise, it's only going to be short-term, the hyaluronic acid. It's only going to have short-term benefit, and you're going to re-squash the cartilage and re-aggravate it and have worse chondromalacia and meniscus problems. So go get stronger glutes. Honorable mentions, get your abs stronger too, lower abs like we've been talking about, and then get your toe curl muscles stronger too, because that is going to help to raise your arch and put good forces through your knee as well. But glutes are usually the big one. Oh, we have another super chat. Let's go over here. Lorraine Boyd. Thank you, Lorraine. I appreciate it. There's no comments on there. I appreciate it, Lorraine. Our staff appreciates it as well. I'm sure they're all clapping right now saying, woo! Thank you, Lorraine. All right, who's next here? I'm skipping anybody. We're just on Nikki. Okay, we got Stephen B. Says, I was diagnosed with bone-on-bone hip arthritis 2 years ago. Been on the program for a year. Been working with Jay for 6 months. Shout out Coach Jay. Now on vacation in Roatan, pain-free. Look at that. Love it. I love it. I'm curious to know, Stephen, did they recommend that you needed to have a hip replacement? Usually for bone-on-bone arthritis, they will, but you didn't mention that. I just want, if you can comment, let us know. Because I'm trying to keep better track of people that are like you watching and commenting. If you were told you needed a hip replacement or a knee replacement, for those of you guys with knee arthritis, and you did our stuff, if you were in our program especially, and you're better now, like, you need to tell people that you canceled your surgery pretty much, or that you told the doctor no and you went and did our stuff and it got better. Big deal. All right, so thanks for updating us on that, Stephen. I appreciate it. Oh, he does have another one. He says, it has been 3 steps forward, 2 steps back. Advice to others, if it hurts, don't push it. Yeah, big deal. I think that's important, because we force our way through exercises, and the whole no pain, no gain mentality, comes into play. And I think it's baloney. We shouldn't be doing that. That's only if you're not hurt. Because think about it. Pain is your body's way of saying something's wrong. Stop. So don't force your way through it. But, and we're talking about, like, if it's a hip problem, don't force your way through hip problems. Like, I had a hip problem last week that I was talking about. Mine's gone. I'm back in here lifting weights. I'm not lifting as much weights as I should be. I'm talking to you guys. I'll get to it here in a minute. And it's necessary to unload your joints, because your joints are weight-bearing structures. And if you just go forcefully doing activity that puts forces in a bad way, especially through your joints, you're going to aggravate it. You need to let it heal, and then you need to fix the muscle imbalances so that you're putting the right forces through it, and then it will heal fully. But you have to slow down. You can't be aggravating it on a consistent basis. Fix the muscle imbalance, and then you'll set your body straight to move forward without having to worry about re-aggravating it all the time. Because that's how most people live, is they aggravate their hip, and then they rest for a bit, don't really fix the muscle imbalance. They just, stay off of it for a while, then get back to activity, re-aggravate it, rest, and they're just in that cycle until they need the replacement and they can't take it anymore. They never fix the muscle imbalance, and then they're having problems even after they get the replacement. Good job, Stephen. I want to make sure I didn't miss any. Oh, Stephen, thank you so much for the super chat. I appreciate it. And he says, yes, hip replacement was recommended. Fantastic. It's so true. It happens all the time where doctors are like, all right, bone on bone, let's replace that hip joint. And it's not always necessary. That's exactly what we're trying to do here, is help people avoid unnecessary surgeries. They're way over recommended. Hip replacements and knee replacements, rotator cuff procedures, meniscus surgeries, other knee surgeries, they're way over recommended. And I don't want to antagonize, surgeons and all that, because I think they're doing the best they can with what they know. They just don't know about this stuff. I feel like I'm the only one talking about it sometimes. I'm sure there's other people out there, but we need to talk about it more, because there's ways to prevent this stuff. Thanks, Stephen. I appreciate you. All right, we got about just a few more minutes left. I am running a little bit late, guys. I had a late start, but I'll see if I can get a few more comments in here. If you have any super chats, now's the time, because I'm going to log off here soon. Hadia says, chondromalacia patella grade 1, can the cold trigger discomfort or pain? This is a good one. When you're cold, especially if you get really cold, your body naturally wants to shiver, right? And what is shivering? Shivering is your muscles contracting really fast and shaking so that you can generate heat, so you're not so cold. Well, if your quads are contributing to the shivering, that might aggravate your chondromalacia patella. That's my suspicion. I don't know that directly the cold to the actual cartilage behind the kneecap is setting off the chondromalacia patella. My hunch is it's more your body's response to shivering, or maybe it's just like the position that you're in. Maybe you're hugging your knees to your chest to try to make yourself into a ball to warm up. Things like that, I think, are what are more likely to aggravate the knees, instead of the actual temperature outside penetrating into the joints. That's likely not to happen, because our bodies are so tightly regulated when it comes to temperature. So watch your position and watch your shivering. Richard says, any recommendations? I already talked to Richard about this. Go move. Just move within reason, within comfort. Don't overdo it, Richard. Oh, Friday. We hold on, Friday. I'm gonna get to you. Let me just I clicked on you on accident. Let me come back over here. I have a couple of super chats in. I have Christopher Robin and then Gita. Thank you guys. Let me answer Christopher's first here. Christopher says, any validity to joint lubricant supplements? The research is so mixed, Christopher. And we're talking about like a glucosamine, chondroitin, hyaluronic acid, MSM is another one. They are worth trying. I don't know about the validity. I think because we don't have enough research out there to conclusively say, yeah, if you take glucosamine, chondroitin, this joint supplement, you're going to improve by 10% or by whatever percentage. We don't have anything like that. We just have that some people say they feel better, others say they don't. There's potentially some side effects like allergies usually to the supplements. The best thing you can do, Christopher, is go try it out. Go get some supplements, take the full bottle, because it's not going to be an instant thing. Like you take it for 2 or 3 days and you feel better right away. Some people say they do. I don't know. I really don't know if it works that fast. I just think we don't understand it enough yet as a medical field. We don't have the research and the knowledge to fully understand it. We're focused on researching surgeries and medications. That's what we spend the most of our research dollars on. So go get the bottle and finish the bottle, and then you decide for yourself, Christopher, if you think that it's worth it. And then you can keep taking it or not. You decide. Gita, thank you, Gita. Appreciate that generous super chat. Let's help you out here. Thank you so for your help with my hip. You're welcome. I haven't been able to find your lower ab videos. Can you point me in the right direction? I don't know if I can comment. Let me see. I've never tried to comment on here. Lower abdominal videos. I'm going to see if I can look this up for you here, Gita, and get you the lower abdominal videos. My computer, and then I think I have to go. I'll be late for my next appointment. Bear with me 1 second. So lower abdominals, guys, are critical for even upper body stuff. When you don't have good abdominal strength, you're just moving inappropriately from the foundation of your body, from your core. And so shoulder motions get messed up. There's so many, the glutes don't work right. Your nerves are going to be compressing your spine. There's so many out there. Gita, I can't find them right now. My setup with my laptop right now isn't great because I'm live streaming. But I will come back to you, Gita. I promise, first chance I get today, and I will message you. I'll find this comment and I will reply to it. So just watch out on your notifications, or come back and check in, and I'll get to this comment. I think I might have a playlist. I'll find it for you, but you need to start with lying on your back, flattening your back. That'll turn on your lower abs. Then doing like little sit-up motions. There's a whole progression to this. So I know I've got videos on YouTube for it. I'll find them for you. All right. Sorry, Gita, I don't have it on hand real quick. Guys, I'm going to let y'all go. Thank you so much for being with me here live. There's 95 of you on right now. If you have questions, comment on here. We try to get back to them as best as we can. It's overwhelming. One of the nice problems we've had is with more members, more subscribers. We can't get to y'all. We're trying to get more people on staff, and we're just slow to do it because we're trying to hire the right people and build a phenomenal team here. So I appreciate you guys so much. Oh my gosh, somebody else super chatted. Chondromalacia patella grade 4, Danu, wanted to know if high impact activities like running or jumping would need surgery. Also want to go trekking. Okay, I'm going to answer this one really quick. Hope I don't get in trouble. Khalid also gave us a super chat, but let me go back over here. Thank you, Khalid. I appreciate it. You can heal from grade 4 chondromalacia patella and get back to running or jumping without surgery, but you got to fix that imbalance. And it's the same stuff I've been talking about. You have to get your glutes stronger. You have to get your foot muscle stronger. Abs need to be stronger as well, so that you unload the kneecap, the patella, so that you don't put pressure on the patella. That's what's going to allow it to heal. I've had grade I don't know what grade I've had, but I've had chondromalacia patella. I've never had an X-ray, but my knee is so crunchy. But I'm deadlifting. I run miles. I can do box jumps, and I can jump off of some decently high places and land just fine. I don't really have any knee issues. It's totally possible. I've helped people do it. We've helped people with bone-on-bone knee arthritis get better. Chondromalacia, we can do that. You got to go fix the muscle imbalance. So that's what it comes down to. And you can get back to the high activity sports. We've had professional athletes get back to it even after meniscus tears. So it's totally possible, but you have to go back and get those glutes stronger. And when you think you've got them strong, you got to get even stronger. And when you've been maintaining the strength there for a while, you have to still come back to it and remind yourself to activate those glutes, even with the simple things like walking. And when you're in the gym, when you're doing those jumping and running activities, you better be focused on how to strengthen your glutes while you're doing those activities. And I explain it all in the program, the patella pain program. That's the one you want to look at if you're interested in our programs. But we've got a kneecap help playlist that would be appropriate for you as well. We got a lot of videos there on how to fix the muscle imbalances for chondromalacia patella. All right, guys, with that one, I'm going to sign off. Thank you all for being with me today. Catch you guys soon. Bye-bye.